Well, good morning. I want to thank you all for being here. I'm joined today by the Secretary of Health, Kim Malsom-Risden. She'll be available to help answer questions if we have some at the end today. I do have a cabinet meeting today, and I'll be discussing with them about guidance on bringing employees in the state back to work. And making sure that we're doing that in a responsible manner and reflecting what's happening in businesses all across the state of South Dakota. I want to remind everybody that tonight we have a special event going on in South Dakota. It's called Let It Shine, and we're asking everyone to go outside from 9:30 until 10 and turn your lights on. Think of creative ways to let it shine, and we will have folks flying above the 12 largest cities in the state of South Dakota recording it that I think will be real inspirational and giving people a picture of hope, knowing that we've been going through some challenging times, but yet we can all come together and focus on the light that can drive out darkness. So encourage you and your family to plan something during this special event to show a light up into the sky that can unify all of us as a state together. Again, I want to remind everybody that our recommendations in place for getting back to normal still require folks to be physical distancing. I know as it gets nice outside, we would all love to go back to how things were 6 to 7 months ago, but yet I still need you to physical distance. I still need you to be diligent about keeping our vulnerable population at home. That they need to be careful if they are over the age of 65, have health conditions, that it's incredibly important that they stay at home so that we can stay on our plan for getting through the spread of COVID-19 through the state of South Dakota. Continue to wash your hands, and if you aren't feeling well, call your doctor. Don't go into the clinic or the hospital, call your doctor, and they will make sure that you have an opportunity to go through the protocols to see if you need to be tested. And one more reminder to download the Care19 app. It's incredibly helpful for us as a state of South Dakota to make sure that we're doing contact tracing in a way that's efficient and allows us to best utilize our time to find out who may have been in contact with somebody and potentially been exposed to the virus. With that, we'll open it up to any questions that you may have today.
Governor?
Sure. Let's go to Bob in the room, and then I'll go to the phone line.
Just real quickly, Bob Mercer, Colorland News. What time will the events be this evening?
Well, we believe the lights will start recording and be recorded above the towns at 9:30. And to 10, and so there's several different towns. They said the 12 largest towns in the state, and I'd encourage folks to be outside and prepared for that to start happening around that time. Here in Pierre, we'll be doing some special things at the Capitol, and I think we've kind of thought out of the box, and people are excited about it, so we're hoping that every community will find a special way to recognize it. On the phone, was there a question?
Yeah, Ray from Kellerland?
Yes, go ahead.
Hi, yes, Governor, you mentioned meeting with the Cabinet this afternoon to discuss state workers returning to their physical places of work. Can you give us an idea of when that might be? And if you can't ballpark that or give us an estimate, when you might release any information on when those workers would return to their physical sites?
Yeah, it'll be different for every agency and department. It depends on the kind of services that they need to deliver to the public and who will be in some of those locations. So public safety will be very different as they have to man driver's licensing stations, different things like that. We also have differences in social services than we do in labor. Many of the folks in labor have been showing up every day for long hours already because of the unemployment filing claims that need to happen. So they will start to bring folks back, and some will stagger shifts. Some will bring a certain portion back in that need to be on site, and each cabinet secretary will be given the opportunity to make the best decisions for their workforce that facilitates getting the work done and also protecting those employees.
Governor JP News Radio.
Okay, let's go to JP, and then we'll go to the second question that was on the phone.
Thank you, Governor. Can you give us any type of an update on the progress of the possible reopening of the Smithfield plant in Sioux Falls?
Well, we've had several conversations over the last couple of days. Our hope is that next week we would have some good announcements as to the reopening. The state is facilitating providing personal protective equipment for them and also testing for them, and we're hopeful that by in the coming days that they'll be able to get back online. But we'll have more details when USDA comes forward with some guidance as well for the facilities across the nation.
Thank you.
There was another question on the phone line.
This is Lisa with the Register.
Lisa, I heard your name. Why don't you go ahead first?
All right. Just wondering on the 3,000 tests a day, just wondering if that means that the medical facilities have enough chemical supplies to process 3,000 tests a day?
This is Kim Malsom-Reisen. Thank you for that question. So 3,000 tests per day is our current capacity. You can see from the numbers that we report every day that we're not seeing that level of people tested. And so we are confident that moving forward, we do have the capacity to get that number of tests done, and we'll be working to increase that to 5,000 per day, which is what we're expecting, potentially as we start to peak here. The 3,000 per day, in terms of processing those tests, would happen at labs at a lot of different levels. So that could happen at the local community level. That would include the state public health lab. And it also includes some commercial lab capacity that hospitals and other providers have the ability to access.
Okay.
Beth Warden with Dakota News Now.
Sure, go ahead.
Yes, the 3,000 test capacity. Do you have supplies to run and complete 3,000 tests per day?
We do for several weeks, and the supply chain has gotten much better in recent days, and we don't anticipate that there would be a shortage in the future.
Okay, and the CDC apparently is indicating that there should be a 1 to 2% testing of the population per week per state. That would be a minimum of about 8,500 for the state of South Dakota. Is that a goal that you intend to set?
This is Kim Malsom-Reisen. Again, we have the statewide testing plan. We are not assigning a percentage per se. The 2% number that you might be referencing is the minimum number of supplies that the CDC wants to see states have. And they're actually helping us get well beyond that. We've been identified as a state that has a very aggressive testing plan, and so our supply chain through the CDC is in May and June slated to be well above the 2% mark.
I'm Ray from Keloland again.
Yes, go ahead.
Can you talk about if there's any other clusters of COVID cases in nursing homes, and if the state would release those in terms of any nursing home clusters?
This is Kim Malsom-Reisen. We do not have any new information to provide. I know on previous calls we've discussed a cluster in a long-term care facility and related facilities in Sioux Falls. That is an ongoing situation, and aggressive testing has happened there to ensure good management moving forward. And again, we've been working very closely with the administration and the staff at that particular location, and their infection control processes are being followed, and they're managing the situation as the CDC would recommend and as we would recommend. At this time, we do not have other clusters to report.
Thank you.
This is Stephen
Morton Richard, House District Union Hudson.
Okay, I heard Stephen's name, so I'll let Stephen go first.
Hi, Governor. I wonder if you have any update on meeting with Smithfield employees, if you have considered that or set anything up, and then if you will be enforcing any social distancing measures or PPE measures or testing measures as Smithfield reopens.
Yeah, this is some of the discussions we're having with USDA and Smithfield, and so I believe guidance will be coming out from USDA real soon on that. Because of the executive order, that the president signed, there's some authorities there that change the situation a little bit for us, and so we're evaluating that within USDA's folks, and then we'll have more guidance for you probably by Monday or Tuesday.
And as far as meeting with Smithfield employees,
Dakota News Now.
Let's go back to Stephen and do his follow-up real quick, and then we'll move on.
if you have any update on setting up a meeting with Smithfield employees?
Yeah, we're talking about that. Obviously, there's not a lot of meetings going on just because of the virus and spread, so we're communicating with them, and we'll continue to make sure they get all the information that they need.
I think they said they were available for a video call. Have you considered doing that?
Yeah, we'll keep you posted on that. Was there another question
Gordon
on the
Richard,
phone?
House Union Hudson Night.
Okay, go ahead.
Yes.
Gordon, was it?
Governor, I'm particularly interested in the language used in back to normal, especially the word never. You talk about never required, never prohibited travel, never asked for face masks to be worn. Could you tell me why that language, why that use of that word in trying to put forth a new plan?
Well, the Back to Normal plan is a pathway and guidance for folks to get back to what things were before the virus hit the state of South Dakota. It's guidance that we're giving to them, and we did not mandate that businesses closed. We did not mandate that families shelter in place. And so this document is to give them guidance on what they could do at the local level to make sure they were still being proactive with mitigation measures, but still make sure that they had an opportunity to continue to take care of their customers, their employees, put food on the table, and try to maintain some normalcy and try to get that back into their lives.
I'll follow up quickly. You know, the mayor of Mitchell used the word bombshell in describing your back to normal plan. I'm just wondering how it's being interpreted and how it will be ultimately lived out.
Yeah, I was very surprised by his comment because it should not have been a bombshell to him. We have regular phone calls with all the mayors. He has the opportunity to participate and ask questions. The mayors were well aware of the guidance that was consistently coming from the state that they could utilize to take action in their communities either way. So we leave the authorities with the local folks so that we can take a targeted approach to tackling this virus and keeping people healthy through the process.
Thank you.
Was there another question on the phone line?
Yes. Yes, I'll take it. Ray from Kellerland, if
Sure.
no one else has it.
Sure, Ray, go ahead.
I think one of the things that we're finding questions from folks is you speak of back to normal, and yet we haven't surged as a state in terms of peak cases. How can you best explain that or reconcile that for the public? Because back to normal suggests one thing, we still have a peak out there, perhaps suggests another.
Well, Ray, as I've said many times before, we're not going to talk about positive cases as based on our modeling and our projections. What you need to focus on is hospitalization rates. And our goal the entire time was to make sure that we had a plan that made sure that we slowed down how many people got seriously ill at the same time so that we could adequately take care of them. So we've been tracking our hospitalization rates and put in mitigation measures to make sure that we could keep people out of the hospital and didn't overwhelm our healthcare systems. By South Dakotans taking action and making sure that they were using personal responsibility, they cut that curve and that peak for peak hospitalization rate by 75%. And that's why now we have the capacity to take care of folks in South Dakota. We know the work the people have done in previous weeks has put us in a great position, and that's why we're giving them a pathway forward to make sure that they can continue to take actions and stay within that capacity and get through this virus in a way that makes sure that those that might need a hospital bed, might need an ICU bed, might need a ventilator will have it, and it'll be ready to take care of them and get them through the situation.
Thank you.
Governor, this is Stephen from AP.
Stephen, I'm going to take a question in the room first, and then I'll come back to you.
Good morning, ma'am. Two questions. One, it's School Lunch Hero Day. How cool is that? Can you talk about that? And then the second question is, how is the progress going with speaking to the feds about getting the money re-earmarked or however that's going to work? Thank you.
So it's School Lunch Hero Day, and we have incredible work being done across the state with delivering meals to kiddos in every school district. So I think that's one of the things we probably haven't talked about for a little while, and I appreciate Joseph bringing that back up, because we have a lot of communities that are delivering meals to kids for breakfast and for lunch, even though they may not be in the building. So if you know somebody that's putting work in and day out to make sure that we're taking care of the nutritional needs of our kids in our state, boy, give them a call or drop them a note in the mail. I know they'd really appreciate that. I've been talking with a lot of folks about getting some flexibility on how we use federal funds that are coming our way as a state of South Dakota, and I think we will have some more discussions, and hopefully we've educated folks on how the state of South Dakota budgets and how much of our budget is encompassed by healthcare needs and educational needs, and that potentially when another piece of legislation moves through Congress, there may be some language to give us flexibility on how we spend the CARES Act dollars. Stephen, did you have a question on the phone?
Yes, I was wondering if you could give us an update on where the state is at in terms of hospital capacity and bed capacity. I know that you've been working towards a 5,000 bed capacity for COVID-19 infections by mid-June. Where are we at with that, and do you have a number that you could give us today?
Sure. This is Kim Malsom-Risden. You are correct that we are continuing to plan and make sure that we've got things in place in the event that we would need 5,000 beds at our peak. That planning is ongoing, and it's kind of done in stages. And so at the hospital level, they have done great work across the state, and I'm extremely grateful for those partnerships and for the work that's happening in communities to identify within the first stage of that planning is really what can happen within the walls of the existing facilities. And how can those particular facilities be surged up. The next phase would be if we need to go beyond the walls of particular hospitals in those communities, what would some alternative care sites be? And so that planning work has happened. We have a plan to get to 5,000 beds. But the good news is that our projections are showing that, right now that we're anticipating needing 2,200 beds at our peak. And so that was rolled out when Governor Noem rolled out her getting back to normal plan. And so that's great news. And we, even within our existing beds today, are well within that number. So the planning continues. We will be ready. But we'll also be looking at what the data shows us and making revisions to our projections as well.
So just to follow up, you're saying that we have 2,200 beds existing today if that was needed for coronavirus patients?
Yes, we do. That capacity is in our healthcare systems already. If you look at the Back to Normal plan, we ask them to continue to maintain 30% of their beds isolated and saved for COVID-19 patients, should they be needed. And also our National Guard has stood up the facilities in Rapid City and Sioux Falls that are there in case we would need a surge and to utilize other resources outside the main buildings of our healthcare systems. So that work has been done. I think if you've been following our National Guard notices, press releases, and social media, you would see some pictures of those men and women stepping up, serving, and setting up those facilities so they're ready to go when we need them. It is at our time, at this time though, I want to be clear, we don't believe we'll even need those facilities, but they're going to be there for backup. I committed to you that we'd be prepared to the 5,000 bed level. We think we're only going to need 2,200. But they're still following through and putting up those facilities to make sure that we have the 5,000 bed capacity should we need it. Go ahead, Bob.
Governor, yesterday with the executive order, you used one of the new pieces of legislation. And in the course of that legislation going through the process a month ago, the NRA, the National Rifle Association, added an amendment to it. And I wondered whether that had your clearance, and then I have a follow-up on that point, but go ahead.
Well, if it was something that had originated with me, I would stand here and defend it, but it was an amendment that came during the legislative process, and I did choose to sign the bill with it on it.
Okay. because it seemed to significantly shape or reshape the point of the law. I mean, it essentially hinders what you can do in terms of weapons and ammunition, et cetera. I didn't know if you had any comment on that.
Well, the legislators weighed in and had debate about that issue when that bill was passed, and when it was put on my desk, I made the decision to sign it, recognizing what the impacts were, but still the fact that we felt it would be a beneficial piece of legislation to have in statute to allow us some flexibility during this time.
And then just to follow up further, the NRA lobbyist, Brian Gosh, former legislator from South Dakota, he was here. He was identified as at the house where the drinking occurred that evening. So was the Lieutenant Governor, Larry Roden. I didn't know whether you had spoken at all with the Lieutenant Governor about that, if you could answer that.
Oh, the Governor and I talk all the time, but that issue I'm not going to weigh in on.
Okay, thank you.
Is there a question on the phone?
Governor Lee Strubinger, SDPB.
Sure, go ahead, Lee.
I was wondering if you had any thoughts or comments on the Harvard poll that was released yesterday, kind of showing the approval of how the state's been handling the coronavirus towards the bottom of the pack.
Oh, dear.
Well, Lee, man alive. It's hard for me to believe that people want to get political in the middle of a pandemic. So if we could just focus on important things instead of playing politics all the time, I think that we would be much better served by those in public office, in the media, and out there on social media and in public. This is a time for us to be united, not to continue to find ways to drive people apart. So no, I'm not spending any time looking at polls right now. Any other questions?
That should do it.
Okay, that should do it. Have a good weekend, everybody.